All right, let's jump right in. Getting a new diagnosis can feel like you've been dropped in a foreign country. All these complex medical terms and tests, it's a lot. So today, we're going to unpack the whole process for multiple myeloma. We'll break down exactly what each test is for and what it's telling your doctors. So if you're looking at this long list of tests and just feeling completely overwhelmed, I get it. You are definitely not alone, and it is totally normal to feel that way. Our goal here is to help turn that confusion into confidence, to give you a real sense of understanding. I think the best way to look at all these tests is to think of them as a diagnostic toolkit. Seriously, every single test is just a different tool, and each one helps your healthcare team build a really complete, detailed picture of what's going on. They aren't just procedures, they're the tools that bring clarity. So, where does it all start? Well, usually, the first tools out of the kit are blood and urine tests. These are really the foundation. They often give the very first clues, and you'll see them used again and again to keep an eye on things. Okay, so these are the big ones we're going to talk about. Think of them as the first-line detectives on the case. Let's take a look at what each one is trying to find. First up, the full blood count. This one is super important because it checks for anemia. That's a low red blood cell count, which is a really common symptom in myeloma. It also tells your doctors about your white blood cells, the ones that fight infection, and your platelets, which help your blood clot. Next up is something called the M-band, or you might hear it called the M-spike. This test is basically looking for the fingerprint of myeloma. It directly measures the amount of those abnormal proteins, the monoclonal proteins, that are being churned out by myeloma cells. So a high number here is a pretty direct signpost for the disease. And then we have the serum-free light chain assay. This is a bit more of a specialized tool. See, some types of myeloma don't make whole monoclonal proteins, but they do shed little pieces of them, called light chains. This test is designed specifically to catch those fragments, making sure that even the more sneaky forms of the disease don't get missed. All right, so once those first clues are in, doctors need to go right to the source for a closer look, and that means doing a bone marrow biopsy. Now, I know that phrase alone can sound pretty intimidating, but this procedure is just absolutely essential for confirming a diagnosis. So why is it so critical? Well, here's the bottom line. The bone marrow biopsy lets doctors go straight to the factory, right where the myeloma cells are living, and get an exact head count. It tells them the percentage of myeloma cells in your bone marrow, and that number is fundamental for confirming the diagnosis and figuring out the best way to treat it. The whole thing actually has two parts, and they're usually done at the exact same time. First, the aspiration pulls out a little bit of the liquid marrow. That lets them look at the individual cells. Then, the biopsy takes a tiny core sample of the bone itself, with the marrow inside, which shows the doctors the whole structure, how the cells are all arranged in there. And just knowing what happens after the procedure can make a world of difference. You'll probably be asked to lie flat for a few hours just to put pressure on the spot. You'll need to keep it dry for about a day, and yes, some mild soreness for a couple of days is pretty normal. The main thing is to just keep an eye out for anything unusual, like a fever or more bleeding than expected. Okay, let's just get to the question that's on everybody's mind with this one. Does it hurt? The good news is they totally numb the area with a local anesthetic, kind of like when you go to the dentist. Once that wears off, you can probably expect some mild pain or just soreness at the spot for a day or two, but then it should fade away. So once the diagnosis is confirmed, the next tools that come out of the kit are for mapping. Doctors use different kinds of imaging tests to create like a map of the body to see exactly where and how the myeloma is affecting the bones. The main reason for these imaging tests is to look for any bone damage. See, myeloma can create these little weak spots or holes in the bones. They're called osteolytic lesions. These scans help pinpoint where those spots are and how big they are, which is just crucial for understanding the stage of the disease. Your team might use a few different kinds of imaging. Everything from a series of X-rays, that's called a skeletal survey, to more detailed scans, like an MRI, a CT scan, or a PET scan. And sometimes, these scans can even find myeloma that has popped up outside the bone marrow, which helps give that truly complete picture. So we've collected all this info, from the blood, from the bone marrow, from the imaging scans. The last step is to put all of those puzzle pieces together. This is how doctors go from just a diagnosis to a prognosis, which is really about understanding the likely path of the disease.
And it's so important to remember. These results aren't just a bunch of numbers on a lab report. They're what we call prognostic indicators. They help your healthcare team set a baseline, they help them predict how the disease might act, and most importantly, they guide them in choosing the absolute best treatment for you. Let's just quickly look at a few of these key indicators. For instance, high levels of a protein called beta-2 microglobulin can suggest the disease is more widespread. On the flip side, low levels of another protein, albumin, can also be a factor. And then there are even deeper tests, ones that look at the chromosomes and the actual genes inside the myeloma cells, which can tell doctors if the disease might be more aggressive. Every single piece adds another layer to the story.
So, look, while getting a diagnosis and going through all these tests can feel like the end of something, it's really truly the beginning. Your tests tell a story that gives you and your doctors the power and the knowledge to take action. So the real question becomes, what's the next chapter going to be?